The faculty and the students present here. I would like to invite Dr. Kapil Shivsagar sir on stage to introduce Dr. Kiran Gadre sir.
Hi, good morning everyone. So, I'm supposed to introduce Dr. Kiran Gadre. Yeah, but he actually doesn't need any introduction, but still, as a, I need to introduce him so that all of you know about it. So, Dr. Kiran Gadre is currently the president of the Maharashtra branch of AOMSI. He has had a private practice since almost 37 years, and at that time probably oral surgery was not considered as a separate branch. It was still considered as part of general dentistry, and it was oral surgeons like him who have given that kind of he's got the branch of oral surgery to the heights that it is right now. So he has been a professor at Bharati Vidyapeeth Dental College and Hospital for many years. He was a reviewer, and he is a reviewer rather to 7 national and many international journals. He is a recipient of numerous national and international awards and scholarships. He was invited and has lectured at many well-reputed dental colleges all over the world. In 1992, he was awarded the Mayor's Medal from Pune Municipal Corporation because he operated on a white Bengal tiger, and apparently this story was there in the, in school books. This was like a lesson in the school books at that time. And he has almost 55, lots of national and international publications. So, thank you, sir.
Thank you, sir. Welcome, Dr. Gadre sir. I now invite on stage Dr. Vaishali Pagare ma'am to introduce Dr. Seemit Shah sir.
Good morning everyone. I, Dr. Vaishali Pagare, lecturer, Department of Oral and Maxillofacial Surgery. Take immense pleasure to welcome our eminent speaker, Dr. Seemit Shah sir, who is my mentor also. Sir passed his BDS from Bharati Vidyapeeth Pune and pursued his masters from College of Dental Sciences, Davangere. Currently, sir is working as HOD and professor at Rural Dental College, Loli. He is PhD and PG guide. Sir is owner of Apex Multi-Speciality Hospital at Aurangabad. Sir has 52 national and international publications. Sir delivered guest lecture in many state and national conferences. Besides that, I would like to share my experience with sir. In those my UG days, there was one person, we saw him and we inspired him, and he is Dr. Seemit Shah sir. Sir is very great human being, great mentor. Sir is approachable to each and every student. Sir is always there. Till date, sir is always there. We call them, sir pick our phone and solve our problems. We discuss the cases with sir, and sir will always guide us and help us. So thank you, sir, for all that. Though Dr. Kapil sir introduced Dr. Kiran Gadre sir, Kiran Gadre sir is also my mentor, and I would like to share my experience, personal experience with sir. Before I could join sir's clinic, I just heard the legendary stories of Dr. Gadre sir that treating lion, tigers and bird. But when I actually worked with Dr. Gadre sir during pandemic, COVID-19, I actually realized how great surgeon he is. When the other medical fraternity person, they are struggling with treating mucormycosis cases, in that era of mucormycosis, sir was there who already treated hundreds of mucormycosis cases successfully. And they not only treated that cases, but they rehabilitated those cases. So they saved their lives, along with they improved their quality of life. Many surgeries I could assist and observe at dental clinics, at Dr. Gadre's clinic, sir, and I would very thankful for that. Dr. Kiran Gadre sir and Dr. of our field. They created literally thousands of good oral surgeons amongst India. I take this opportunity to thank Dr. Kiran Gadre sir and Dr. Seemit Shah sir for always inspiring us, guide us and teach us to be a good oral surgeon. Thank you, thanks a lot sir. Thank you.
Thank you, ma'am. Welcome, Dr. Gadre sir, Dr. Seemit Shah sir. I would now invite on stage Dr. Vikram Karande sir, Head of Department, Oral and Maxillofacial Surgery, and invite Dr. Dean sir, Anuj to felicitate our guests, Dr. Gadre sir and Dr. Seemit Shah sir. Thank you, sir. I now request all the health departments and Dr. Dean sir and our esteemed guest speakers to come join us on stage for the lighting of the lamp ceremony. Vikram Karande sir to now introduce the topic trauma awareness, saving lives, saving faces. Welcome, sir.
Seemit sir, Honorable President of our Maharashtra State Chapter, Dr. Kiran Gadre sir, Dr. Seemit Shah sir, who is our immediate past President, Dr. Anuj Dadhich sir, who will be joining us a little late today as his flight has been delayed, who is the General State Secretary of the Maharashtra State Chapter of the Association of Oral and Maxillofacial Surgery of India, respected head of departments, faculty members, staff and students. I welcome all of you today to this occasion of trauma awareness, saving lives, saving faces, which is organized by the Association of Oral and Maxillofacial Surgeons of India. Now let me tell you in brief about this campaign. Now, the AOMSI, or the Association of Oral and Maxillofacial Surgeons of India, has decided on their motive to save lives and save faces as a campaign which is going to be held every year across the nation. And last year, I am proud to announce that we crossed the world record for delivering this lecture across the colleges in India, saving lives, saving faces, and which was to be a world event. Now, today is a very special day because we have organized the state chapter conference of our association in Pune city. Today is the first day of the conference. So 1st to 3rd of February 2024 is the Pune State Chapter Conference, which is ongoing with our event. So we are highly honored today, Dr. Kiran sir and Dr. Seemit sir and Dr. Anuj sir, that you have graced the occasion today at D.Y. Patil Dental School. Welcome sir. So now I will like to start my topic on the trauma awareness campaign. I would request all the faculty and the students to kindly pay attention, because what I am going to speak is not just words, but this is something which we take very casually and which we need to seriously imbibe in our lives, each and every one of us, and which is something which is going to create a big impact in us as a nation, a society and the world. So let's face it, that is the initiative of the AOMSI. Now we call ourselves maxillofacial surgeons. We are the guardians of the face. Our specialty deals with various kinds of treatments required for the face, including the mouth and the teeth. Saving lives, saving faces. Please note that our profession is at the forefront of ensuring that the most visible part of your body, the face, is safeguarded, and in turn we save lives too. So you can call ourselves as the bouncers of the face. Now I would like to bring to you a couple of stories. Meet Rohit. He is a college dropout and he had a very brilliant academic career, but he had to drop out from his college and start a roadside eatery. Although he was a very good student, he had to drop out. And can you guess why? Because his father forgot something. Meet Pooja. She is also a college dropout and she was pursuing her masters in theatre from one of India's topmost colleges for drama. One day, she suddenly dropped out of college. She had to drop out because she too forgot something. Meet Sid. Now Siddharth is the son of a colleague at my hospital. His friends arranged a birthday party for him, but he did not attend his own birthday party. All the plans were a flop. He too forgot something and had to pay the price of it. Now what is it that these people forgot? I am wondering, I am sure that you must be wondering what it is that they forgot. There is a common thread that connects all the three people, and how forgetting something simple can lead to life devastating consequences. Rohit's dad forgot to wear the seat belt and left the family to fend for themselves financially. He had to drop out of his college to take care of his family. Pooja's dreams of being a dancer and an artist took a break as she forgot to wear a helmet the other day and ended up with a face that does not seem like hers at all. Siddharth also forgot to wear his helmet and met with an accident and had to miss his own birthday party as he was in the hospital with an extensive face and head injuries that led to a coma. Now please note that these are not rare stories that happen on the roadside, but these are everyday occurrences. So that is what I am trying to give you a reality check today. Globally, 3 people die every minute in a road accident. So that's almost 1.5 billion people, which equals the population of many small countries. Closer home, on Indian roads, every 3 minutes, 1 person dies in a road accident. Almost 44% of all accidents involve a death, and they are on two-wheelers. Especially pillion riders are the most vulnerable to these accidents when it comes to riding a bike. 62% of all the road death accidents are under the age of 45. Now 45, my friends, that is the most productive time of your life. That is the time of your life when you are almost about getting settled. At least I can say that about our profession, and we especially as oral and maxillofacial surgeons, I would like to say we start our careers at that age. So India is growing fast and is on its way to become the automobile capital of the world, and ironically the accident capital of the world too. We have never seen a boom of automobile in our country like the way we had today. Like in my time, the only cars that I used to see on the road was a Fiat, a Maruti 800, a 118 NE. That is if you are the rich and the elite. But today, everybody seems to be driving every kind of a vehicle. So in fact, the saddest part is that head and facial injuries are among the topmost causes of death in road traffic accidents. Shocking, isn't it? So why should you care? As I said earlier, the part of the body that's most visible to everybody is your face. Your face is your persona, your personality. And we, as maxillofacial surgeons, can do our best to protect not only the face, but we also protect the lives, because we are face and head surgeons. Right? So we go from being oral surgeons to maxillofacial surgeons to craniomaxillofacial surgeons. Now these are the statistics, the dreading statistics that speak for themselves. Please have a glance. The number of people killed, and these are real life statistics from World Research Economics. So now let us see why are road traffic accidents so prevalent. Number one, there is rapid urbanization. There are poor safety standards. There is lack of law enforcement, and drugs and alcohol. Drugs and alcohol, as you all know, is the most common, so prevalent amongst the youngsters, the college-going crowd of today, even school-going crowd of today. All of you must be better aware about it. Poor safety standards. With so much rapid urbanization, the rise in the population, it is very difficult for the government also to implement these road safety standards. And the law enforcement agencies are at a loss to understand how to control this population boom, so we cannot even blame the government for this. Now, the ones who are injured and survive are the worst affected. Now this statement speaks for itself. To survive and to suffer, right? So these accidents lead to disabilities which alter your life, alters your lifestyle. Life never remains the same after these accidents. There is an emotional burden and there is an economic burden which go hand in hand. Now, how do you solve this situation? What can you do? What can I do? What can you as the audience, as the students, as the citizens of this nation, what can you do to prevent this problem, to help us with road traffic accidents? Now, we at AOMSI believe that we can't solve this problem without you, the young future of India. Your proactive actions are the only ones that can help us as a nation to cross the tide of this problem. Now, number one, now this is all of you would agree, is a very understated statement. Wear a full face helmet at all times. I sincerely request you, me and all the dignitaries and all the staff from Oral and Maxwell official request you, please wear a helmet. And a helmet has to be a proper helmet with a proper shield. Right? There is no point simply putting the helmet, not locking it up with the belt, and not having a glass cover. These all are mandatory when you wear a helmet. It has to fit snugly on your head. Even the pillion rider, the one who sits behind on a bike, should also wear a helmet. It is very, very essential because as you all saw from the statistics, the pillion rider is the one who has to face the brunt of the trauma. Most of the time the pillion rider flies off the motorbike and he is the one who lands up with life-threatening emergencies. Right? So this is what I was saying. Use a full face cover and a completely transparent visor with a helmet. Wear a seat belt. How often would your parents or your elders must have told you to wear a seat belt when you sit in a car, right? So it has to be clipped at all times, and it is one of the most essential requirement when you are driving, whether you are driving or whether you are sitting in a car. See, the kind of accident cases that I have seen, most of the times what happens is that the driver or the pillion rider or the passenger seat, okay, the person completely flies off onto the windshield, and many times they have been flown off the front windshield onto the road. Can you imagine that? Okay, this is as scary as the stuff that you see in our movies. Alright, but it happens, and especially the one sitting on the back side, the back seat is not tied up, so the entire back seat just offloads onto the front windshield. These are real problems. Please understand this. So now let us watch a video that it is a powerful story that will explain the importance of the helmets and the seat belts.
Yes. one life. I think we all have, haven't we? But seriously, what would go wrong that one bit, just to when you step up, just that one time could be your last time. Or you could live with a scar forever.
So I hope you all earned a lesson from that video. Now, Mr. Anil Kumble, as you all know, has been operated by one of the members of our fraternity. He had a jaw fracture, right? So he did volunteer for this cause and shared this beautiful video with you. Now, what can you do? You can be a good Samaritan, right? Now, be a good Samaritan at all times. A good Samaritan is a person who in good faith, without a particular motive or a self-interest, delivers health care and help to a roadside victim. So we all have to be good Samaritans. So now I would like to call upon Dr. Seemit Shah sir on stage, who will continue this presentation from here on and will explain you about what is a good Samaritan and what are the life-saving measures that you can take to save these road accident victims. Thank you so much.
Thank you, Vikram, and thank you, Vaishali, for this kind introduction of us. A small thing which I would like to elaborate before this, probably you all are youngsters coming here, probably traveling through the bikes and the cars daily, maybe in Pune you might be traveling 50 kilometers a day probably, that's what I suppose. But now if you see the statistics, what Vikram sir has told you, first thing, the life what we are losing in India due to road traffic accident, the age group is very important, that is 25 to 45. So this is a vibrant age group of the vibrant India, and most progressive youth of our country we are losing, and the number is quite high. The second important thing of this was, now you see the statistics, the bike riders, they are more safe because of the fear of helmet and fines applied by the police people. But we are losing more pilot drivers or pilot riders are losing them. And if you see the statistics in four-wheeler, the number of passengers getting injured and losing their lives is more. The drivers are being safe nowadays because of compulsory seat belts, the cars coming up with the warning signals and giving bips on every time to the drivers. But specifically, now onwards, we have to focus on the people or the family members. We have to save our family members, our children, our loved ones, which are at more danger. If you see the statistics of last 2-3 years, the passengers are at more danger point because they don't wear the seat belts, and that's what we want to elaborate. Now, that was one part of prevention. Unfortunately, after prevention also, this is unstoppable because of high speed, fast tracks, easy. Everybody wants to reach early. Nobody wants to wait. So these are some of the social and psychological issues of our human nature, which are again responsible for road traffic accident. But how many of you have seen a road traffic accident actually? And how many of you have seen? How many of you have seen people coming to casualty, apart from us who have been posted in casualty departments, and we have been part of trauma team in our hospitals, and we have seen preliminary patient coming to us. But on spot, how many of you have stopped at the spot to see what is going on? Anybody apart from me? Maybe my teacher, Kiran, sir, Kapil, and Vaishali. Apart from oral surgeons, how many of you have seen this situation in your life? Anyway, it's fine. Yeah. So you can put on the slides. The slides are more important than looking at my face. So I would like to. So what do you mean by be ready to be a Samaritan? What is the meaning of Samaritan? Anybody can tell me what is the meaning of the Samaritan? Huh? Yeah, definitely.
The person who helps at the roadside accident without any selfish.
Not only at the roadside accident, the person who helps the person in the difficult time is called a Samaritan. It can be a war time, it can be a COVID time, it can be any disaster time. So we are talking about road traffic accidents, and hopefully I feel that everybody will have a chance to see this in near future if somebody has been. And if you are in that situation, what you should do? You are definitely protected by law, but you have to do certain things. Unless and until you don't do these things, you can still be a part and parcel of problems if you don't follow this law. First of most, to be a good Samaritan, you have to stop there, be vigilant, be how the crowd is. Now, today morning I was discussing Gundha Mantri. Right? This is a word which is famous in Pune and around Pune and maybe everywhere nowadays. So there are certain areas. If you are not at a fault also, you may put yourself into a danger if you are in that area. So be vigilant first. Look yourself, what are the associated around you, and feel safe. Then if you know that you are not a culprit or you are not running away from the thing, stop there, look at the victim, call 2 numbers. What are the 2 numbers you have to call? Anybody? First number to call. Ambulance. What is the number? 108. Right? Everybody knows about it. What about the second number? 100. Definitely. These are the 2 numbers on you from your cell phone. You have to tell it. I'll tell my situation. This has happened to me. Being a good Samaritan, we stopped and we picked up the victim. No, none of the family member was with the victim. We put him shifted him to the hospital, but we didn't call up the police. Second day when the family member came, somebody gave the number of our car, and the police came looking after my car. This can happen, and probably you have to prove your innocence that you were not innocent. So 100 is an important number to become a good Samaritan, and that you have been stopped here and you are picking up the victim to certain hospital for this thing. So one is 108, call the ambulance. If ambulance is not coming and you want yourself to pick the victim to the nearest place, you have to call 100. These are the 2 things you have to do in case of, that is the first point. Stop for the help, offer medical assistance if you are capable of. If you are not capable of, then call 108. What helps you can do as a primary caretaker at the spot? What helps? Yeah, what first aid you can do? What is the first thing which comes to you? तर आपण कोणाला बघितलंय की याचा पडलेला आहे, पहिले काय बघतो आपण? How many people have fainted in their anatomy or dissection hall or looking first extraction where it's the blood? You have to see for the open wounds where the bleeding is going on, and this is all okay, this is all okay, this is just keep up. If there is an active bleeding wound, you have to apply pressure wounds, and then you have to check for the consciousness of the patient, whether the patient is conscious or not, whether the patient is breathing or not. So check for the airway obstruction. There's one more point about full, it's a debatable thing, full face helmet. If you have been working with a neurosurgeon, they will advocate do not wear a full face. Why? Because your cervical spine is more prone to injury in a case of full face helmets. So it's a debatable thing. But as a maxillofacial surgeons, we would definitely promote to save faces. So cervical spine injury, you have to observe for the cervical spine injury, you have to take care of the neck at the spot of the thing. You cannot just tilt the neck completely so that you can aggravate the cervical spine. You have to stabilize the cervical spine first. And it's for the airway, there is one maneuver which is called as chin lift head tilt. It is only the tilting of the head at your first cervical vertebrae. So that will ensure the airway. If patient is not breathing or there is a shallow breathing or there is obstruction of the airway, this is one maneuver you can do. This is the point. Wherever the bleeding wounds will be there, apply pressure. Whatever thing you have, there is first aid kits in many of the cars, there are bandages. If you don't have, you have handkerchiefs, you have dupattas, you have so many things which can be applied on the spot to help. If bleeding is profuse, you can use your belts, ropes to act as a tourniquet. If it's a long bone injury and you feel there is a profuse bleeding from one of the bleeding and you want to apply the tourniquet, tourniquet can be applied to the major vessels of arms and legs. Keep victim warm. See that they don't go into the hypothermia. Hypothermia can cause depression of your airway muscles, the lung muscles, and cause again problems with the respiration. So warm victim will be always better. So these are the things you have to do at the spot. As a first responder, if you are there, how many of you have attended CPR? Basic life support, because I am talking in the professional college where we are going to be called as a doctors. How many of you? I would request the principal sir to take at least one basic life support course for every third year and final year student. Every third year. We have made it compulsory in our colleges. We have skill labs in our colleges. Probably you can be a part of your bigger college in Pimpri. Probably they have the skill labs in the medical colleges, and make it compulsory to at least give this basic life support courses to each and every member of a BDS team.
Sir, we have started with the American Heart Association, and on the 12th this month, we have a course coming up, BLS and ACLS both.
You can make it as a value-added courses for third year and final year. Interns is okay,
right.
But I feel that from third year onward they should take this courses. So yeah, this is how you should go for. Check for the response. Check on the shoulder. Baba bara hai ka? Baba aiku yete ka? Baba jeep dakhwata yete ka? Practically you have to tell in the local languages what to the victim. If you are there, whatever, Hindi, Marathi, whatever language you can. Sab theek hai kya nahi? Shake the shoulder. If patient is not responding, it has to be loud and clear. And you have to check for the unresponsiveness. If patient is unresponsive, not breathing, the first thing you have to do is clear the airway. Look for the breathing. Look and feel whether his chest is moving with the breath or his stomach is moving up and down with the breath. Whatever type of breathing, shallow, rapid, you have to assess whether he is breathing or not. Or you can feel the air coming out of the nostrils with your, right? Observe the chest movement, listen to the breathing sound, feel the breath on your cheek. If responsive, well and good, you can call for the help, call 108. There's a victim. Probably it will take 10 to 15 minutes to reach to the spot. If he is not breathing normally, then you have to do this. This is called as cardiopulmonary resuscitation, which is also called as basic life support you are giving to the patient, right? So this is, you might have seen in movies, chhati pe thokte log, right? Same way you have to perform it. I will not go in detail about all this because you need to have this thing, but in simple way, in the center of your chest, in between the two nipples, there is a sternum. Everybody can feel your sternum. So that the center of your chest, you have to put your palm on the sternum forcefully, and the compression should be 5 centimeters. It has to go 2 inches. It is usually 2 inches. You have to compress the chest down. Let it recoil, again compress. So this cycle has to go 100 per minute. 100 per minute. It has to be like that. And if you are a single responder, if you don't have anybody else, after 30 compression, wait, 30 compression should finish within 20 seconds. Within 20 seconds, you have to finish 30 compressions. Right? This is how you give it. Place your heel of the hand on the center of the victim chest. Place the heel on the other hand of the top of the first hand. And then compress till the 5 inches. So after 30 compression, you have to give 2 breaths to the patient. If you have 2 responders and if you have 2 people, it is 15 compression and 1 breath. 15 compression and 1 breath. It is like that. But hopefully, right? If the patient is breathing normally and you feel the patient is safe, this is the best position to put the patient. Instead of supine, where the tongue can fall down or there's some this thing and even the breathing becomes difficult. Lateral position, like child sleeping position, we can also call this position as a child. Usually, small child sleeps in this position. So this is the position you have to and check for the breathing again and again whether the patient is responding or not. Right? After the help comes to you or you are shifting it in some car, the proper position till you shift the patient into the hospital is extremely important. This is all over, control the bleeding. In case of long bone fractures, if you feel that some of the leg, major bone or hand, major bone is injured, you can apply some splint, temporary splint to this long bone so there is none of the movement. Why it is important? Because the most dangerous life-threatening situation can arise from long bone fractures. This is called as fat embolism. So you can prevent fat embolism if you can just splint them in a proper position and immobilize them for temporarily till you shift the patient to the. Yeah, neck immobilization is extremely important because cervical spine injury is the most dangerous injury. I would like to die on the spot better than staying in a vegetative stage for a whole life if you have a cervical life. You will be totally in a vegetative phase. Your brain will be working, you will be able to see and speak, but you will not be able to move none of your body parts. So giving importance to your cervical spine is the most important thing while immobilizing the patient. See, professional ambulance, cardiac ambulance, they do have this specific splints and specific stretchers and specific mobilizers where they will take care of the cervical spine. But if it is not there, you have to help the victim with your hands so that its cervical spine doesn't fall down jerkingly. Right? These are different splints which can be applied, but if it is not there, the first point in the G figure, with your hand, you have to support the cervical spine so it doesn't get injured. So these are some big precautions you have to take. These are all professional cervical spines which are usually, but picture A is the important from our point of view, where you don't have gadgets to support the cervical spine. Right? Holding the neck properly or supporting the neck and the head together when you are holding the victim from the shoulders. There's a video. Can anyone place the video? Yeah. So this is a video representing how it has to be done on an actual spot.
At the accident spot is not to panic. Be proactive to understand the situation and seriousness of the injury. Turn off the vehicles immediately and call for ambulance. Move the victims to safer grounds. While lifting, be careful with the posture. Do not leave the neck to fall. Neck, shoulder, and legs should be lifted at the same time. or if unconscious, make them lie down on flat surface onto their sides. Apply pressure with clean cloth over the bleeding side to prevent further bleeding. If the victim bleeds through here, please be extra cautious. If the victim asks for water, please do not give them. Do not crowd. Give adequate ventilation for the victim to breathe. Loosen their clothes and listen to their heartbeat. Check for pulse. Check if they are breathing. Check for the rise and fall of their chest. If the victim does not have heartbeat, place your hands on the left side of the chest and perform chest compressions immediately. 100 to 120 chest compressions has to be done per minute. If the victim is not breathing, pull out their tongue to improve the airway. The time period of 60 minutes following accident is called golden hour, which requires prompt medical treatment to prevent death of victims. If no pulse, continue the compressions till ambulance arrives. Thousands of people die on roads without proper first aid. Be responsible. Your first aid can save a life. Carefully to the ambulance in lying down position.
So this was a small representative video which can show you actual how you can probably this is how you should do it when you are there on the spot. So definitely prevention is always better than cure. I would urge everybody to be attentive on the roads and be preventive to prevent road traffic accident. But still, if something is there in your faith and you meet with an accident, be a good Samaritan. Be a good Samaritan and try to save lives. Think of that. If same thing happens to some of your family members and none of the helps, they get what will happen to that family. So every family, like I don't know, the things have changed over here. When we were in the school, the first thing in the morning we used to have this prayer. All Indians are my brothers and sisters. Correct? Probably the same oath. I don't feel now, even my children, they don't have this oath in there, but still, definitely, whoever is a member, he has a family, he has someone, some members are waiting for him. So if you give them a prompt help, medical help, will able to save at least 10, 20, 30, 1% of the life is good. You will have a very good sleep at that night if you can save 1%. Think of it. So this is an urge which is being made. This is a great man, Gadre, who is a visionary and is giving us a tremendous roads and so many things that as a development. But with development comes problems also. If you are not attentive, if you are not, see, the government alone cannot do anything. Government is made by us. We are a part of this country, and if we don't help our government, the government will not be able to. We are seeing our economy as so many trillions plus. I was very poor in math, so I don't know these numbers well. But you all people might be knowing that we want to be the first in the world, but it is not single-handedly. Everybody of us has to join hands with the development. We have to develop our mindset. We have to be cool. You have to be compassionate when driving. This is a daily affair. जैसे अपन मंदिरात जाताना चप्पल काढतो. Everybody is sure. निकाल देंगे ना, आपने कोई भी इष्ट देव को प्रार्थना करने से पहले अपन चप्पल निकालना है. से में मेक इट कंपल्सरी कि गाड़ी में बैठने के बाद बगैर हेलमेट के बाइक राइड नहीं करना है और सीट बेल्ट कंपल्सरी करना है. If you, that's a simple thing. That's how you should do it. So this is a message from
of Oral and Maxillofacial Surgeons of India has planned International Oral and Maxillofacial Surgeons Day in a very big way in this year. It is going to contribute for the people by and large. Our medical profession has got really a good status and recognition in the whole world. Our doctors prove to be best in the world. And today, the research is very important. By accepting the new technology, new innovation and new research, you are making this field qualitatively strong. And I am really happy the way in which you are discussing the issue, making research on it and doing practical experiment. It is to be a very, very important thing for the society, for the noble cause. I am really happy. I am giving my best wishes to all of you once again for this Surgeon Day of this particularly important cause is very important, and I am giving all best wishes to all of you, and I am confident that your knowledge, your experience and your successful technologies 100% going to help you for the society and for the nation for the future. Thank you. Namaskar.
any doubts from anybody, any questions anybody wants to ask anybody. This discussion for 2 minutes probably will open this floor. Now you can put on the lights here. Because we have been taking this lecture to this specific group of 18 to 25 age group in different colleges, professional colleges, non-professional colleges, degree colleges, even age group 11 and 12 people classes. In last year we had this message from Gadre was last year's message. Our delegation met him and we proposed him that our association want to do this initiative to make aware the young children who are going to start their driving career or driving necessity, whatever. It is part and parcel of our life now. So now if you want any questions are there with you, you can ask us. We all 3 or 4 people are here. You can, many of the people, many of the institute we had, government कुछ नहीं करती है. ये क्वेश्चन है, गवर्नमेंट कुछ नहीं करती है, ऐसा आपको कितने लोगों को लगता है? किसी को नहीं लगता? Good. Because these are the initiatives which have been taken. And I'll ask you a question again as an examiner now. How many of you have gone through these amendments and laws which are there for driving license? How many of you have taken your driving license seriously and given a test? And how many of you? Raise your hand. All of you have passed. Not more than 50 members I can see here. So, खा खिला के पैसा खिला के 500 रुपए 200 रुपए देके देने वाले कितने हैं? दोनों हैं. ताली एक हाथ से नहीं बजती. You cannot blame. Hello, but at least if you are conscious, we praise. मैं दुबई गया था, क्या रोड थे? मैं जापान गया था, मैं लंदन गया था. अरे why? Because consciously the people of Japan, the people of Dubai have senses. How to follow the traffic rule, where to put the rubbish. So we have to train ourselves, and the younger generation have to train each other. If your friend is missing, जोश सबसे ज़्यादा यही एज ग्रुप में रहता है, और होश उतनी जल्दी खो लेते हैं ये लोग. At the age of 50, maybe at the age of 20, I was like you only. मेरे दोस्त को किसी ने बोल दिया तो दौड़ जाते थप्पड़ लगाने के लिए भी हम कम नहीं करते थे, मगर सोचे समझे कि गलती किसकी है. इसलिए we want to appeal this young group, young audience sitting here, to be a good human being, good citizen of India, and we can prevent this and we can save so many lives by training ourselves in a primary healthcare. management at the spot of an accident. Thank you very much.
Hello friends, it's like helmet and seat belts are like Kavach Kudli. Kavach Kudli, Karande lost it and lost his life. Okay? So they are like Kavach Kudli, that's the first thing. Secondly, don't ever attempt to apply tourniquet at the neck, even if the patient is bleeding from the mouth. Okay? Let's remember it, otherwise that more dire consequences if you apply a tourniquet at the neck. Thirdly, rules and regulations do not mean anything. It's self-realization and basically it is your conscious. How do you feel? Like if I do something wrong, do you get a restless night or you sleep well? If you cannot sleep well, if you are doing wrong, I'm not talking only about wearing a helmet. That is part and parcel of the whole thing. But it's your own conscious that how do I feel? Like if I jump a signal, maybe it might not be involved in an accident, but do I feel good after that? If I feel good, then you can keep on doing that. So if you have a restless night, please don't do that. Fourthly, is whatever CPR or anything is shown. CPR is like it is easily said than done. You try and give a CPR to a patient, 100 compressions in a minute. It's really tough. And if you try to give it with your wrist, it is still tougher. It has to be coming from your shoulder, the whole pressure. Okay, it's really tough. And now in today's world, there is also a fear. I don't know the infective status, the HIV and HBsAg status of the patient. So sometimes that might be a bothersome thing before we jump into giving CPR. That's one of the major issues. But if you can find a pipe, small tube, you can give CPR to the tube. There is where the maximum risk is. Okay? So that's, instead of giving a direct mouth-to-mouth respiration, well, you lose the pleasure maybe sometimes. But at the same time, if you insert a pipe, a longer one, so even if the patient vomits or coughs or something, it doesn't splay on your face. And if you put a pipe and use that pipe for CPR respiration, it will be good. Okay? There is just safeguarding yourself, like without having fun, you might hide out in the seats. Okay.
Thank you so much, Dr. Gadre sir, Dr. Shah sir, and Dr. Vikram Karande sir, for opening and enlightening us about such an important campaign. I now welcome Dr. Kiran Gadre sir again on stage to shed a light on the evolution of oral and maxillofacial surgery in India. Please welcome sir.
Do you have a pointer? It's okay. Am I audible with this? Start up. Well, in concurrence with the Stroma campaign, Dr. Vikram Karande and Principal Dean Dr. Singhley had requested me to deliver a lecture on something to make people aware of what maxillofacial surgery is, because not many are aware of what the advances in maxillofacial are. But it would have been a very long lecture of 1.5 hours. So I thought I would cut it short and relate myself only to trauma part of it and just talk a small presentation on how was the evolvement of the management of facial trauma. How did it start? And I have practically witnessed a sea of change. Like I was a postgraduate between 83 and 85. And then I have seen a sea of change, and what the sea of change has been, not only in the treatment, but also in imaging. Imaging has come out with wonderful techniques, and that we will see to it, and certain anesthesia techniques. Like to give you a small anecdote, when I started my practice in 87, and my son was born in 85, who today is also a maxillofacial surgeon. So that was the time when we used to do long cases, like 4 hours, 5 hours, and beyond. So that time, ether and trilene were the only anesthetics. The anesthesia administered was an open anesthesia. The circuits were not closed. So by the time I come home, I was to be equally zonky as my patients. You know, like drowsy and, you know, feeling frenzy. So, like my son used to say, I hope everyone understands Marathi, or they will understand this part of it definitely. My son used to say to my wife, like, Baba daru kyun alay ka? That is to be thing. So, and now the anesthesia techniques have changed. Ether, trilene, and those exist nowhere. Today, more emphasis is on muscle relaxants and putting patients into different stages of anesthesia. So, I'm thankful to Dr. Karande, Dr. Shingli, Dr. Vaishali, and everyone over here, and Dr. Kapil, who gave a wonderful introduction. Whether I deserve it or not, I don't know. But surely, you made me feel good. The feeling of good was a nice sensation. So, evolution of management of OMF trauma, let's go to the next division. Trauma. So this is what I meant, strangulation. Don't apply a tourniquet, okay, in the head and neck region. Now if you see, injury to the maxillofacial region are unlikely to cause death. But amputated limb, mutilated limb can be amputated. Amputation of OMFS region is, you can imagine what can happen. And this is what happens when you look at something else, the barber in particular, when he is supposed to do his job of shaving, you know, so you can cut a carotid maybe, okay? So 2 decades back, how were the facial fractures treated? Mostly they were used by extraoral approach, or what is called as external, that's not intraoral. Mandibular fractures were treated by maxillomandibular fixation. Now remember, intermaxillary fixation is a misnomer because you don't fix 2 maxillas together. It's always the maxilla is fixed to the mandible. So it's MMF, not IMF. Or interdental or intraosseous wiring. Intraosseous wiring, like I'll tell you, my teachers, when we used to do open reduction by extraoral method way back in 81, 85 or so, you know, then the trumpet used to be blown for almost a week when we did a open reduction with intraosseous wire. Okay? So, middle 1/3 were treated by craniofacial suspension, and it is widened space. It is a traumatic telecanthus. There is playing of the nasal plates. The right maxilla has been pushed downwards. There are dissimilar alar bases, flat cheek, increased vertical dimension of the face, and you see that patient with a total correction post-operative 5 years. Again, if you see, practically there are no scars because most of the treatment was carried out with a bicoronal approach which extends from one tragus of the ear across the head to the other side, and you can just peel off the scalp just like a banana skin. Okay. Again, yet another patient, anophthalmos, change in pupillary levels, and increased supratarsal fold. And if you keenly see, there is a foreign body in the. If you see this X-ray, there is a broken burr which was there, or drill, which was when the patient was treated by somebody else. And this was inadequate fixation. And what was adequate fixation is seen on the left-hand side. Again, this is the fourth one. This is a marginated fracture case, orbital dystropia. Now, what was done was 6 months post-op. You see on the right-hand side, use of calvarial bone graft. It gives you a very good bone graft, which is membranous bone graft, lesser resorption. Then anterior open bite, on-leg grafting was done for orbit, lefoid bone osteotomy was done, and you can see the post-op. Here, you see a typical blow fracture of orbit, change in pupillary level with rotation of globe, restriction of superior gaze. If you ask the patient to see superiorly, the right pupil remains fixed and stationary. And if you see, what is this appearance called as? Periorbital flat herniation. Yes, anybody from final year? Lecturers. What is it called as? Teardrop, And if you see that, inferior rectus has been entrapped. Okay? So that is how this was a blow fracture of orbit. Inferior blow. So this video is again not going to work. But what you do, this is called as a forced duction test, where you hold the particular muscle, now in this case the inferior rectus, and try to pull and see the tap, how much pull you get, and compare it with the normal side. Okay, so that video is not going to work because they have put it on the Google Drive. This is a condylar fracture, bilateral condylar fracture. Now, when it is a bilateral condylar fracture, it has to be treated. At least one condyle has to be done by open reduction, minimum. Then you can see a lag screw put at the angle fracture. This is what we can do by intraoral approach. So, what I learned was the extraoral approach, which gave a scar, and this intraoral approach doesn't give you a scar. But remember, not all cases have to be treated by open reduction internal fixation. You can see at the top, the fracture of the ramus of the green stick fracture ramus of the mandible in a young boy, maybe 4 years, with stable occlusion. His occlusion was normal. So we just kept him under observation, okay? And then gradually the remodeling happens. That is one. You see a bilateral condylar fracture in a 2-year-old boy, never go and treat it. Treat it conservatively. Okay, there are 2 cases on the top. Okay? And if the green stick fractures of the mandible, you see all the fracture lines on the right, this side, X-ray, you see, those are all green stick fracture. Occlusion was normal. Again, you don't treat the patient. Depressed frontal bone fracture with change in interpupillary level. The frontal bone has been left frontal bone. The frontal bone has been elevated. There are different methods. You can use a rib graft. Okay. You can use canthal ties. You can use calvarium graft. And this is you can do a soft tissue grafting. This one is the flap. This flap has been, fistula over here. This flap has been taken from the forehead and it has been pasted over here. You can see that in the last picture, it has been pasted there. This video was very wonderful. This is what is craniofacial fractures. Now, put up a video like this, so you can show those videos. where there's a traumatic telecanthus, you can tie the medial canthi together. So you go by a bicameral approach, identify the medial canthal ligament, and you can see that tag on the medial canthal ligament. When you pull the medial canthal, the tag, nylon, it gives you a pull on the medial canthus. That's how you identify the medial canthal ligament. That's a post-action test. That's you're holding the inferior rectus just now, and you can compare it with the other side. Rather, it was this side, and this side was a fracture, and whether your reduction has been good or not. Okay? And then the last video I wanted to show was this. This is what is pulsatile brain in a craniofacial fracture. You can see the pulsations. Can you see the pulsations at the top? So that is how the brain pulsatiles. And it's not only humans I treat, I do veterinary maxillofacial also. There was one of the tigers treated way back in 1991 where I was an endodontist and I was an endodontist as well as a surgeon. I did a root canal for the canine, removed the supernumerary tooth on the top of the canine, and closed the oronasal fistula. You can see the oronasal fistula over here. And that's a small, the tiger is awake. Huh? It is not under anesthesia. They put it in what is called a squeeze cage. It's like a large cage. The tiger goes horizontally, and there is one more door where that door keeps on squeezing the tiger to one end of the cage. So finally, if the width of the tiger is 3.5 feet, he squeezed it 2.5 feet. And on top of it, you use a variety of iron bars, really 1 inch in diameter, which go around the neck, around the back, around the chest, between the two legs, and that is how you immobilize the tiger. They've got tremendous power. If just you squeeze him, and he can just take a exactly 360-degree somersault, and we have experienced that. Okay, you can't believe the amount of power they have. And you can see that infant feeding tube over here, which was used as a sinogram, okay, to see where the sinus is opening. Put it between blue and see where the sinus is opening. This is a root canal, and that is a porcelain fused to metal crown done by one of my friends, Dr. Vikram. So that's in a dog fight, and this dog was a Great Dane, lost his canine. It was a show dog. A canine losing a canine, and then he is useless for a dog show. And he doesn't get a mate even because he's lost his canine. See? So we see that canine which has been avulsed in a dog fight. Of course, the other one was also Great Dane. And you see the crown made out of it, and the aesthetics was restored, and the patient could go for a dog show. Yet another fracture mandible bilateral bucket handle typical in a dog, treated by a veterinarian unsuccessfully, and did a ORIF. So that is the difference in wiring and plating, and that is what I emphasized upon. What is the difference between wiring and plating, and the end result. You see the wiring has been done over here, and plating has been done here. The wiring doesn't give you adequate fixity, stability. Here is a peasant bird with a fractured lower beak, fractured mandible, fixed with 3 wires, okay? Which, it's a transmandibular wiring, and done with a 20 gauge needle and a 24 gauge wire. And a deer fawn with a fractured mandible, treated with plating. And this guy who is assisting me He's presently a consultant in MaxFax in Australia. He's done his MaxFax as well as plastics FRCS. And do you know what is head transplant? It is the zenith of maxillofacial surgery. And what is it? Ganpati, a head transplant of an elephant head, is the zenith of maxillofacial surgery. And thank you for your patient listening.
Thank you so much, Dr. Kiran Gadre sir, for that wonderful presentation. It is always such a pleasure to hear you. Now we have with us Professor Dr. Anuj Dadhich, who's come all the way from Loni to grace the occasion. Please give him a wide applause. Now I would like to call upon stage Dr. Anuj Dadhich sir and Dean sir to felicitate Dr. Anuj Dadhich.
I would now like to call upon stage Dr. Neha to deliver the vote of thanks.
Good morning, one and all. Before the conclusion of this program, I am here to deliver a vote of thanks. First of all, I would like to mention about our chairman, Ajit Patil sir, and our director, Dr. Rahul Hegde sir, because of whom we are here today. I thank them for creating such an academic environment over here so that we could arrange such programs. Then I would like to extend my gratitude to our Dean sir, Dr. Anuj sir. He has always supported us to organize such events, and he has always spared his time from his busy schedule to even see the minute details of every program, and always supported us for that. Thank you so much, sir. Special thanks to all our guest speakers, Dr. Kiran Gadre sir, Dr. Seemit sir, and Dr. Anuj Dadhich sir also has joined us recently. The oral surgeons of my generation, we have always looked up to them. We have attended many conferences and workshops, and we have listened to their talks, lectures, video demonstrations many times, and they have always inspired us to be good surgeons, to be good ethical doctors, and great teachers also, just like him. Anuj sir might not be remembering, but he was my teacher in MG Military College, Nashik. So thank you, sir. I would like to extend my gratitude to all the HODs and faculty of all the departments of DYPDS to be present here. Thank you so much for your patient hearing. I would like to thank Dr. Vikram Karande sir, my department HOD, for leading us to organize such a good event, and for his talk also. Thank you, sir. I would like to extend my gratitude to all my departmental colleagues, Dr. Vaishali, Dr. Kapil sir, and Dr. Pratik sir also, who is not present here today because of the pre-conference courses of our conference, and a great team of these interns who have worked effortlessly to organize such an event. Thank you so much, the wonderful audience over here, my students, final year students. I'm sure you got inspired today from whatever presentations you have seen. And can I expect some oral surgeons from your batches? Okay? Okay, great. Before conclusion, I would like to ask all the faculty members, HODs and guests also to assemble over here for a group photograph. Thank you. Thank you so much. On behalf of our association of oral and maxillofacial surgeons of India, we are thanking you all to become a good Samaritan whenever you face such situations in life. So please be there for help. Please be there for victims or any traffic accidents. And don't be scared. Please be there to help. Thank you. I would request all the staff to just wait. We will have one photograph of the speakers.
सर आइए अरे सर ऐसा मौका नहीं मिलता है आ जाओ मौका नहीं मिलता है
अरे जल्दी आ रख रहा हूँ फोन, एक सेकंड रुक।
सर आप हम निकल नहीं 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 तुम लोग जाओ यार, तुम लोग अरे यार नहीं
So why don't we set up on the table and then all of us take it?
you know how I just take photos. सर मैं लेता हूँ प्लीज। अरे यार हाँ
Why don't you stand in front over here? तो बेटर में तो पीछे जाना पड़ेगा सर। On 5th, I'm coming back on 18th. That's impossible. That is 4-5 days. You have got a collection of more than 50,000 signs. Whatever if you never want to cancel. Yes, sure. Yes, sure. Easily. Some orientation for interns and so they're always crazy, but then they realize the reality. So oral surgeons are poor, one thing. Then second, they don't earn like doctors. They don't earn like doctors. Like it is very tough because what I always say, in other branches of dentistry, the competition is only from the general dentist and only that particular specialist. Like perio, and the general dentist. Okay, but the surgeon and the oral surgeon or the maxillofacial surgeon, you are having competition from the oral surgeons, from dentists, ENT, plastics, oncosurgeons, orthopedic, everybody is there. There's a lot of grey area.
ENT also.
ENT also.
You want to do everything.
So you got to really be good in medical things if you want to progress further. So unless they know about medicine, we know about dentistry. But we should know more about medicine than what they know about dentistry. Only then you can become a successful max max. And you can really give them a tough fight. And many times the general surgeons think whether to refer it to oncosurgery or whether to refer it to maxillofacial. It will be that good. So you will. If oncosurgeon can perform to this level, so to get references, you should be one step above the oncosurgeon. Only then you will get references from the researchers. And that getting that, it's always easy to gain 75%. But just 1% above that, 1% above that, going this way to score 85 becomes really bad. So it's easy to go from 50 to 76. But from 76 to 85, it is a tough job. And 85 and beyond is still tough. These are the works we do for. Looking forward to them. Yeah, after 18th I'm coming back. I'll need some time to settle. Because once I'm away, there will be a big queue of patients. Yeah. So somewhere in first week of March we can do it. Definitely. Yeah, sure. First week of March will be fine. If you want to say call, I will go in.
नहीं तुम लोग भी रुको हेल्प करने के लिए